to introduce Les Matthews, who's one of the board members of Mitigare. He's going to talk to us today. He and his fellow panel will talk to us today about hospice care in San Miguel. Thank you for coming.
Thank you. I first got involved in hospice care in the U.S. in 1991, and that was kind of the early days of hospice there, and not too long after the Medicare benefit expanded to cover hospice care. So since that time, today in the U.S., there's over 5,000 hospice programs, and it's a $28 billion a year industry. By contrast, here in Mexico, Mitigare is the only home care hospice palliative care program in the country. And there are 125 certified hospice care, palliative care physicians in Mexico, 2 of which you'll meet today that are on the board of Mitigare. Mitigare is also involved in more than just delivering hospice care locally here in San Miguel. We are also very committed to promoting hospice care throughout Mexico and Latin America. In 2019, we did the first international symposium on hospice care, teaching healthcare providers about doing hospice care. We had over 400 attendees here in San Miguel. This was May of 2019. It was a 3-day symposium to teach them hospice palliative care skills. And again, attended by not only Mexican healthcare providers, but all over Latin America. Due to COVID, we had to put our future plans for that on hold, but we do plan on resuming it, hopefully in 2022, but certainly in 2023, to be sort of the promoter of hospice care, not only here in Mexico, but throughout Latin America. So thanks to the 3 remarkable ladies that you'll meet today and Lee Carter, we have this program here, the only one in Mexico. And I'd like to introduce the 3 ladies I alluded to. First is Dr. Lourdes Tejeida, who is our medical director and founder of Mitigare Hospice here in San Miguel. She did her hospice care training at the National Institute of Cancer in Mexico City. She also worked for the Secretary of Health in the state of Guanajuato and oversees 15 specialty clinic programs throughout the state. She has earned numerous postgraduate awards and degrees. She has a master's degree in public health administration, specialized training in palliative care, oncology, bioethics, and bioethics research, and a diploma in thanatology. And a diploma in clinical toxicology and special training and education. And she's also a trainer for LNEC, which is the end-of-life nurses education program that Mitigare sponsors here. Dr. Silvia Chavira, who's on joining us via Zoom this morning, is also a trained hospice care doctor. She received her certification of palliative care after completing 1,850-hour internship with the National Institute of Cancer. She's a leader in the development of telemedicine throughout Mexico and has helped us incorporate telemedicine in our home care program here in San Miguel. And she serves as the coordinator of the Call Home Care Visit Referral program for the International Cancer Institute. She is currently coordinator of clinical studies in pharmacology laboratory at the Allende-Midday Scientific Corporation. And she is also a certified train-the-trainer for the end-of-life nursing care program. Also with us today is Martha Hamill. Martha has a long history in the field of thanatology, and she's also a founder of Mitigare Hospice. She is a bioethicist and has contributed to several books and as well authored Thanatology, Bioethics Before Human Suffering in 2013. Martha has a degree in business administration and a master's degree in bioethics and is a founding member of the Pan American Bioethics Association. She's a founding member of the Department of Thanatology and the Mexico Red Cross and a professor of continuing education here in San Miguel. So without further ado, I'd like to turn it over to Dr. Tejeida.
Good morning, everyone.
Good morning.
Thank you for the invitation for us. Okay. Please, Silvia. Oh, thank you. Well, my place today is to explain to all of you what is hospice care, why we are here, and why we are asking for your help in the way to help us to help others, and maybe help you. Okay. Palliative care or hospice care, it's a way to spend the rest of your life in the best, with the best quality of life. Sorry, but the letters are so small, but you can keep it. This is a diagram to explain that in hospice care, you are attended for a full team. You can have help 24 hours a day for the 7 days by phone or at home. We can provide you nursing care. We can provide you the bereavement support, but the most of all the hospice care is provided for the specific team and a specialized training team. And this kind of care is provided you at home or wherever you call home. Okay, we help families because we can train the family, we can train the caregiver, so we can provide all the care that you need. If you are in a bad situation about terminal illness or not terminal, but a new diagnosis with a bad, or I don't know, we'll say bad impact in your life. Okay, next, Silvia, please. Okay. In this photo, you can see that the unique and other medical care, the focus of hospice care isn't to cure the underlying disease. Our goal is provide the higher quality of life possible, whatever time remains. Next, please. Next. Thank you. Okay, where to receive hospice care? Well, if you're not receiving hospice care, Ordinary facility hospice staff will make regular visits to your home or other settings. Hospice staff is on call 24 hours a day, 7 days a week. We are available all year, all days, all night. Who can provide you this kind of care? Well, our focus, our goal is the patient and the family. And he is the medical director. We have nurses. We have other members of the team, like therapists, nutritionists, psychologists. We have all the group for bereavement. We can see what is we have volunteers. Okay. We have volunteers, and we have a specific and very high training team and as a caregiver. We can recommend you the caregivers. Who is involved? Okay, as I said, a hospice care team typically includes doctors, nurses. Next figure, please. Social workers, volunteers, other professionals. Well, we can speak about a therapist who can provide therapy if needed, and the bereavement counselors. Marta is the head from the counselors group. Next, Silvia, please. it's very important to show you that we are a very big difference between palliative care and hospice care. The hospice care is when your diagnosis shows a very short period of life remaining, less than 6 months. And the palliative care is all the symptoms that you can feel or you can have when the disease is begin. Okay, so you can be in palliative care when you receive the diagnosis, not only when you are in the end of your life. And this is very important. Imagine, so you can keep the presentation and you can read this, because it's very important to know the difference between palliative care and hospice care. And we provide both. We are ready for both. And we are providing both. Next, Silvia. Okay, we also training. And Mitigare has been training all the areas involved in the care of patients require hospice care and palliative care. Doctors, nurses, social workers, caregivers, psychologists, bereavement counselors, and other specialists. Next. And also we can train the family, friends, neighbors, and volunteers. Next. When to call for palliative or hospice care? Well, we can provide comfort. Palliative care can begin at the diagnosis at the same time as treatment. Hospice care begins after treatment of disease is stopped, when it is clear that the person is not going to survive the illness. Next, Silvia. And this is another mention that you can consult. When call, when will I receive this care, that's it. Next, Sil. Hospice care. During COVID, we are ready to provide the care if the patient got COVID. Dr. Vasquez is other doctor who work with us, and he is the person who attend these cases. He is an ER doctor, and he can go to your house and see what happened with you if your diagnosis is COVID. Okay, see, next. Do you have questions? Or you can wait to the end.
Let's wait for questions.
Yes,
and,
okay.
Okay.
Marta is next?
I don't know. Yeah.
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 15 minutes and you are next.
Okay. Good morning, all. Thank you for having us all. The Mitigare staff here. We are very pleased to be here with you. And what is my core in Mitigare? Since we have the diagnosis of the patient, we give bereavement in all the illness, and then we keep on working with the family. Today, more than the presentation, I want to make an exercise with you, the people that are in Zoom and the people that are in the room. I want to ask some questions. I want you to think them, and then we develop this. If you want to close your eyes, it's okay. So, for all of you, today you went to the doctor, and after several studies, your loved one was diagnosed with a terminal illness. The outcome will be very, very soon. What are your feelings now that you know this, that your spouse, your child has a terminal illness? With whom are you going to share the news? How are they going to react? If it is your spouse, how are your children going to react? How are you going to spend these last months or last weeks or days with your loved one? What are the outstanding life issues that have to be resolved? Deaths, inheritance, you have to talk, you have to be forgiven, you have to ask for his forgiveness. Are you comfortable to talk to your loved one about what he really wanted in life and he was not able to do? What are the pendings? Remember that the time is very short, probably 3 months. How do you feel and how does he feel about his abrupt change in life? What is your biggest fear? What is his biggest fear? Can you help him? Will you be able to talk with him about the plans for his funeral, cremation? These are the kind of questions that your exercise is done. This is the kind of exercise I wanted to propose this morning, but this is what we see in real life every day with our patients. And here is my core. I give this emotional support with some of our psychologists there in hospice. Since the patient has the diagnosis and we follow them through all the steps till the end of life. I'm just going to tell you about patients. I cope with all the feelings that the family, because in hospice, as Dr. Tejeda said, we just don't work with the patient, but the family. For me, the family is my patient. So we cope with anger, depression, denial. And for instance, right now I have a patient. We have a patient. He's 83 years old. He has prostate cancer. I just saw him Saturday. Dr. Vasquez told me he knows the prognosis, the diagnosis. And the family said, we already spoke with my father. He knows his diagnosis. And when I arrived there, he just said, oh, I don't know what's going on with me. I just felt in March and things tend to complicate it. And I'm in this situation that now I cannot move from my bed. I cannot even go to the bathroom. I cannot take a bath or do my regular daily things. So here again, my work is to try to take this patient to acceptance in order to close all or give him these questions in order to have quality of death. In hospice, we said, we give you quality of life, but also we give you quality of death. And you're not going to have quality of death if there is denial, if there is anger, or if there are some pending things that you want to say and you're not able to say. And the other patient, very briefly, is we had a very young lady that she has cancer. She has 2 kids and a husband. And when we thought that the death was imminent. I had a chance to work with the family for about 4 to 5 months, more or less. And when our patient died, she was able to leave all her penance, talk to the girls, talk to the husband, leave letters, say what she would like the girls to be because they were 10 and 8. When she left a letter for when the first daughter would be 15. And she left a different letter when you get you met your first boyfriend, etc., etc., etc. And after our patient died, I keep visiting the family and give them what we call bereavement after she died. And I was working for a couple of months with the family, with the girls, till they heal. My core, as I said, is when the diagnosis starts till the family has healed with the bereavement and they are able to do again their normal life, even with this great, great loss. Thank you very much. And if you have any questions, please feel free to share.
Okay, does anybody out there have any questions for our guest? Tony?
What are the costs involved in using hospice?
Okay, Lee, you want?
Yeah, I can answer that. So anybody can have hospice. We work on a sliding scale. We have a patient assistance fund that helps people who otherwise can't pay for their care. Some people pay as little as 100 pesos a month. Everybody pays something. Nobody gets it completely free. And the scale goes from 0 to 10. A person that's on the 10 scale is paying $250 a week. That's the highest that it can be. 80% or more of our patients are getting some sort of support, and most of them are down in the level of 0, 1, 2, and 3.
I have a question here from Melody. How can you help someone who lives alone with no immediate family in Mexico if you get an end-of-life diagnosis?
Okay. So that's a big complicating situation for us, that a person who they're alone, we cannot offer good care unless there's someone there to oversee. We don't go into the house and stay there 24/7. So there needs to be a person there that can manage the situation, pay the rents or whatever like that. They don't have to be providing care necessarily, but there needs to be a person. And with the expat community, that's often a difficult situation. We have one patient right now that he didn't have anybody, but a friend of a friend sort of stood up and said, okay, I'm going to do it. I'll take care of it. And it's someone who could, someone that we can call and talk to if we need to do it. We are talking about trying to help form home care groups where 4 to 6 people who are alone can band together and share their medical data and share information so that if one of the people in the team gets ill, that the other people in the team can be their responsible person and help get them the hospice care. It's impossible to ethically, in many ways, it's impossible for us to go take care of someone unless they have someone who, quote unquote, is the responsible person.
All right.
May I?
Yes, please.
Yeah, right now, the patient that Lee was mentioning, we found out that he was very attached to his driver or gardener. And what we did, Lee spoke to the gardener, and he is the one that is being trained by the nurse weekly how to handle all the procedure and how to give him his medicines. And the nurse is every week checking on him. So we kind of see who are the nearest, even if they don't have family, who is the nearest person or the person attached to that patient. But we try to be the best.
Have you seen many patients or many, what's the word I'm looking for? I hesitate to use the word clients, but have you been seeing people during the COVID pandemic?
Yeah. Yeah, was it for patients? Dr. Vasquez is he has a special training with patients with COVID.
Yeah.
And he is the only one who can do that.
All right, very good. Gary Peterson, you have a question?
Yes, I do. I have a son-in-law who unfortunately in the next year or so will be needing hospice care. What are the major differences between hospice care in Mexico and the United States?
The place. Only the place in which provide the care, because the most of the U.S. in the U.S. The hospice care is provided in a specific building. Here we provide the care at home, and the principal difference between the U.S. care and Mexico, here specific in San Miguel, we are available 24 hours a day, and we have a very close relation with the patient and the family. And we stay with the patient and the family when the patient is dying.
Thank you.
So there's different skill levels in Mexico amongst the different professionals. Like, for example, there's typically it's a doctor that puts the sonda. Yeah, typically it's a doctor that would put a catheter and things like that. Whereas in the United States, the registered nurse does that kind of thing. And the nurses in the United States have more skills. And so in Mexico, for example, with us, the doctor very often is visiting at least once a week and sometimes twice a week. And then if a situation is a complicated situation, the doctor may be visiting every day. That you won't see in the United States. But the care in the United States is wonderful, and the care here is also wonderful. And we have the same philosophy of care for hospice that they have in the United States. And we've invested a lot of years. We started this in 2016. We started Mitigare, and we've been building a talented team since then. I think we have good care here.
All right, Sylvia, you.
Also, I'm sorry.
Yeah, go ahead.
We go, as they say, maybe every day, but also at phone, we are 24 hours. So that's a big difference. We are always with them. If they need us, it doesn't matter if it's on the night, they call us and we are supporting them by distance, but at the same time, they feel very protected with our presence there.
I know that for a number of years, I sat on the board of Hospice of Michigan, and our main philosophy up there, and I'm sure is yours here as well, is it was always death with dignity.
Absolutely.
Yeah.
Yeah.
Okay. Anybody else have any questions?
I have a question for Lee. You mentioned that you may be facilitating groups of people that are alone to, how would that work?
Give me your name and email address, and once we get ready to start doing that, then we'll invite you to be part of that.
Okay.
Or to be part of it.
How many people? How many people do you have, including staff and volunteers, within the organization?
Not very many. Let me see, we have 3 doctors, 2 nurses, Martha, and there's another.
Social worker.
And a social worker,
What's psychology?
psychologist. We have a lot of people that aren't involved on a day-to-day basis, but they're, when we need them, if we need a nutritionist, for example, we
Right.
have somebody who can call.
It can be said that these people are truly angels of mercy. Any other questions, folks?
I have one.
Yeah.
Or not real bit. Can you speak a little bit, what, if I have a friend that's sick, how can I refer that person to Mitigare? Because I know that you just can't go see somebody unless you've been invited. So how would I, if I have a friend that's sick, how would I get them, how would I refer them to Mitigare?
For a patient who's living alone or?
Yeah, for example, I couldn't just call hospice and say, hey, I have a friend that's sick, and you go see, you know.
Well, we have a situation, but it's very important that the patient knows that we are notified about the situation. It's very important. The law says, well, when the patient receives any treatment or any medical visit, he needs to know. The patient needs to know and accept. Okay, you can call us and say, well, my neighbor is in very bad condition and I think he needs hospice care or palliative care. Okay, please, you only need to notify the patient that we are coming.
So the patient, member of the patient's family, or another doctor has to do the referral.
The doctor can refer. Yes, we have a lot of patients from Dr. Ramirez.
Yes.
But when only the friend calls, we need the approval from the patient. It's important.
Yeah.
Because we had in the past a lot of situations when the friends call, you call me and Lulu, Marta is in very bad situation, and I went with Marta, and Marta said, oh, no, I never asked for help. Please get out.
So yeah, you have to be very careful when you're doing a referral.
Yeah.
That the patient or somebody in the patient family is calling you in and inviting you.
So when the patient lives alone, the friends can call, but please notify to the patient. And we can.
If you have a friend that's sick, you need to talk to the friend and say, look, there's this organization. Here's their phone number. Why don't you give them a call and we can tell you what's available.
Yeah.
And also for bereavement, it's very important because I have many calls telling me that these people need bereavement. But as Dr. Tejeda said, does this patient really wants to have the bereavement therapy? So it's very important that the patient itself asks for the help, because if not, it will function. And also, well, right now the process that we have a lady there in the office that usually she receives the call, and if the patient is going to be in Mitigare, usually what the Dr. Tejeida and Dr. Vasquez, if they are referred by a doctor to have all the complete file of how the illness has to be developed. That is very important. And so from there, we can start working and make a plan, the medical plan, the bereavement plan, and all the integral care.
All right. Go ahead, Peter.
Financial help. How can somebody like me participate? Is there any way to be of service?
That's a good point. So, unlike the United States, there's no reimbursements for hospice care in Mexico. So we're not getting any money from the government or the Secretary of Health or anyone like that. So to be able to give everybody care, we have to raise money. And so the first answer to anybody that says, how can I help? We can say, give money, you know. In the United States, using trained hospice volunteers is very common. To train earlier that are available to do it, but we have on the average 10 to 12 patients at a time. And until you have, in particular, and we only have maybe 1 or 2 expat patients. So for an English-speaking person to volunteer, we don't really have enough opportunity for them to get their teeth into it, right? We're going to expand the volunteer program as we get more people. Does that answer the question? Yes.
Kind of, sort of. Yeah.
Money first, huh?
Money's good. Money's good.
Lee, I know that you had mentioned that, you have people that are paying as little as 100 pesos a month. And you do expect everybody, you said everybody pays. Enrique has a question. He wants to know if there's a range cost.
So typically our patients are paying 1,000 pesos a month or 2,000 pesos a month. I think that's the most typical situation. We have one expat patient right now who doesn't have any money, but he has a friend that's supporting him, and he's paying the full $250 a week for him as a matter of friendship. But the typical patient for us is 1,000 to 3,000 pesos a month.
Okay. All right. Any other questions out there?
What is the phone number?
I have that number right here.
Very good.
It's 415-111-7637, and that's Monday to Friday from 9 a.m. to 4 p.m. And for more information, you can send an email to contact to Mitigare. Wait a minute. Carla, help me with this. What is that? Contacto?
Mhm.
Okay. Contacto@mitigare.org. And the website is www.mitigare.org. So I want to thank our guests for joining us today. It's been very, very informative. And I want you to know, even though Ron Feltner, club secretary, normally prepares these wonderful certificates of appreciation, we always show it at these meetings. We can't do that today because Ron is not here. But we will be sending you, suitable for framing, certificate of appreciation for each of you. A donation of 10 polio vaccines will be made in your name as showing our appreciation for your appearance here today. So thank you very much for joining us. Thanks, Dave.